Borderline personality disorder. This condition affects 0.5 to 5.9% of the population, those of which 75% are women. Borderline personality disorder is characterized by a high suicidal rate, severe functional impairment, co-occurring mental disorders, intensive use of treatment, and a high cost to society, according to the DSM-5. Borderline personality disorder, or BPD, can be identified in individuals by an inability to have interpersonal relationships, feelings of emptiness, a crisis of identity, and impulsivity, though the most notable way to identify BPD is self-harm and suicidal attempts. The suicidal rate among individuals diagnosed with BPD is 8 to 10%, which is 50 times higher than the general population. The cause of BPD, like many disorders, is a combination of both nature and nurture. BPD has a notable genetic basis with a heritability around 40%. Genes linked with BPD appear to be caused by dysfunction of both serotonin and dopamine transmitter systems, as well as by decreases in neural number. However, even with a strong genetic correlation, 60% of the disorder is left to environment to onset the disorder in individuals. It is very typical among those diagnosed with BPD to have experienced severe trauma during childhood. Typically, this trauma is far more adverse than the typical childhood trauma. Poor environmental features turn on genes that result in impulsivity and poor emotional control, which leads to the poor behavioral choices characteristic of the disorder. According to the DSM-5, psychotherapy with pharmacotherapy is the best way to treat patients with borderline personality disorder. The pharmacotherapy targets cognitive perception, affective symptoms, and impulsivity, while psychotherapy will attempt cognitive behavioral, interpersonal, or psychodynamic treatments. However, these methods of treatments are simply designed to help patients cope and function within society, not to cure them. Thank you for watching.